Hello, and Talkin really here. The story is out yesterday, and you may have missed it. It's sort of buried away, and it's in The Guardian. And the story relates to the story that I just listened to on the BBC, on the daily broadcast from Parliament. There was a question there about people being not given health care if they are, deemed to be unworthy, or in this case, their condition is going to be futile. And the question was categorically answered that no person would be denied health care. But unfortunately, this article says otherwise. So the article in The Guardian, it's not only the you-know-what that risks infecting society, our prejudices do too. So guidelines about who could be too frail for treatment must not discriminate against disabled people. Unfortunately, the BMA, the British Medical Association, has set out guidance to ration treatment if the NHS becomes overwhelmed with you-know-what. On the BBC programme just now, the Health Secretary, Matt Hancock, said that they had many beds with ventilators above and beyond the requirements for patients at the moment, providing that people adhere to the rules. But this obviously suggests that when ventilators are scarce, those facing poor prognosis could have their life-saving equipment taken away from them, even if their condition is improving, with the favouritism going towards the younger and healthier patients. But we are already seeing this play out. Last week, one man tweeted that his brother, who lives in a care home with a limited mobility and a cognitive disability, went to hospital with a chest infection but didn't make the cut, and he died a week later. Meanwhile, it's been reported that a GP practice in Wales issued DNR, do not resuscitate, forms to a small number of patients, ensuring that emergency services would not be called should they contract you-know-what and their symptoms worsen. One adult social care provider said that 3 of their services have been contacted by GPs to say that they have deemed the people that they support should all be DNR. One woman who has received the form so far is in her 20s. These stories of disabled and older people being denied care have been emerging for weeks as the you-know-what has struck hospitals around the world, but have generally failed to find attention outside of the disability community until now. The National Institute for Health and Care Excellence, NICE, was forced to make a U-turn last week on their advice for the NHS to deny disabled people treatment, but only after disability groups threatened legal action. NICE had told doctors that they should assess patients with conditions such as learning disabilities and autism as scoring high for frailty, thereby meeting criteria to be refused treatment based on the fact that they need support with personal care in their day-to-day life. In a health crisis, it's not only the you-know-what that risks infecting society, but our prejudices. It's a slippery slope of ethical compromises in a culture of medical system that already struggles to support people with disabilities. Research shows that an estimated 1,200 people with a learning disability die avoidably every year due to poor care, whilst the terms learning disabilities or Down syndrome have been given as a reason for DNR, do not resuscitate, orders. Doctors are having to make difficult clinical judgments. Would a medical intervention help a patient, or does their underlying health condition prevent them from benefiting? Their argument is that it's better to facilitate a peaceful death rather than administer a futile and distressing treatment. However, judgments based on the efficacy of treatment are not the same as judgments based on the quality of a disabled person's life. That might be falsely equating support needs with frailty, or adopting a blanket policy that withdraws treatment from a whole group of people rather than basing decisions on each individual's needs and choices. That isn't healthcare. It's discrimination. These are complex issues, and we are in deeply difficult times. Medics are risking their own lives for the NHS and will face impossible choices as even oxygen and face pumps run low. But that should not mean abandoning debates around key decisions. Indeed, in an emergency, it is more important than ever to question our attitudes and responses. It is worth considering why the default position is to deny life-saving treatment to some disabled people rather than to ask why a wealthy nation that has months to prepare doesn't have enough resources in the first place. It is worth considering whether talk of limited resources is excusing and normalising the long-held idea that disabled lives are disposable. In recent days, I have seen disabled people take to social media to list their achievements, as if trying to make a case that they are worth living and worth saving. A disabled person who has their ventilator removed during this crisis may have gone on to cure cancer, but then they may have just been loved. A mum with heart disease who always burns her daughter's birthday cakes. An accountant born with muscular dystrophy who watches Doctor Who every Sunday. Disabled people, like all minorities, are only fully human when we are permitted to be as wonderfully average as everyone else. Utilitarian calculations over the value of certain people's lives may appear pragmatic right now, but they cost us a part of ourselves. In the coming days, it is inevitable that Britain will lose more lives. We need not lose our humanity too. And there we go. So quite a shocking story that seems to be coming true, even though on telly they are saying that it's probably not going to happen. But we know what happens on TV is not real life. And we also know that the Tories, that they lie. So let's pray and hope that none of us need to go into hospital and require a ventilator. Right, that's it then. Thank you for watching. Don't forget to thumbs up, like and share. And I'll catch you again. Bye for now.